and you can't hear her wave wildly or something. So I'm going to present the first part of the presentation really quickly because it's just really kind of going to be a brief overview of TMS and kind of what we're doing, a little bit about the machine, a little video. And then I'm going to turn it over to Dr. Pollard, who's going to take a much deeper dive into the science behind it. And I always emphasize with a PhD, I am not the medical person, he's the medical person. He can answer all those questions because I really can't. So we'll just kind of jump in. And first off, what is TMS? I can't tell you how many times I've been asked that question since the ads started coming out for this. The quick description is it's a medical technology breakthrough for the treatment of depression. It's not invasive, and Dr. Pollard will explain a little bit more about how it works, but it's really primarily a helmet. There's no medications or anything to go with that. It's for people who have not responded to other medications or treatments for depression, and at least that's how insurance looks at it and when they pay for it, when other treatments have failed. And it basically uses magnetic fields to stimulate the nerves in the brain, and again, Dr. Pollard will take a deeper dive into that. Statistically, in the research studies done with it, they find that 50% of people experience full remission from depression and 25% experience partial remission. And again, keep in mind, those are people that have not responded to other medication treatments, so that's a pretty good record. In actual practice and talking to people with clinics, they actually see higher rates. And in our clinic, one of the things that Dr. Pollard and Krista Blau and Sandra Nelson, our physicians in our practice, uses genetic testing, and that genetic testing gives them some markers to help identify people who are going to respond better to TMS as well as other medication treatments. Depression statistics, so this just kind of gives you an idea of how big depression is in the United States and in the Bighorn Basin. 7.1% of the U.S. population at any given time is experiencing depression. Of those, about 70% will fail their first medication treatment for depression, and then that means, in the case of most insurances, but not necessarily all, that then they would be eligible for TMS treatments. In the Bighorn Basin area, that translates into about 4,000 people who are depressed at any given time, and about 2,800 of those will not benefit from their first antidepressant trial. So that gives about 2,100 people in the Bighorn Basin that could be potential candidates for TMS. That's obviously a big number, and ours is not a big clinic. We can't take on 2,100 people at once, but we can start making a dent. How long will it take to get better? Generally 4 to 8 weeks. 20-minute sessions, usually 5 times a week, and Dr. Pollard will talk more about this too. That's not a set in stone, that's just kind of how the clinical studies were done. And up to 32 sessions or is directed by your psychiatrist. In general, they report that people start to notice improvements after 2 to 3 treatments, and that those effects just continue to build over time. Common side effects are side pain. I'm going to back up a slide. If you notice the slide there, he's wearing a helmet, and under that helmet is a little cloth that fastens under the chin. So most of these, wrong direction. Most of these side effects, the side pain, about 25% of people experience are due to just the pressure of the helmet or the cap that goes under that, and those tend to diminish over time. Sight discomfort, 19%, jaw pain, about 10%. There's a very slight risk of seizures with TMS, and then other side effects are no different than placebo groups. This brief video I have for you that is just somebody who's gone through TMS, kind of telling his story, and his psychiatrist giving a little bit of his story. And this all worked great when I tested it before. We'll see if it works now. How about that? Everybody hear this okay?
My name's Joe. I'm 52 years old. I've had depression since late childhood, taking different medications for depression and mood changes for a number of years, and none of them have really taken effect. It's basically been like taking an aspirin for the depression.
We went beyond just antidepressants. We tried every combination of other medications that are commonly used in the field to try to augment those antidepressants, and he didn't respond much to any of them. Deep Transcranial Magnetic Stimulation is a process whereby an electrical current is passed through a coil. It generates a magnetic field into the brain, into the area that is underactive, and it stimulates those neurons by generating an electrical current in those neurons.
While getting the dTMS treatments, I didn't feel any side effects. Calming for 20 minutes of treatment, and I felt good. People have recognized changes in me through the dTMS treatment, especially my wife. She's happy with what's going on. I enjoyed life for a change. I could sunshine. My wife's smile. I could relate to different things. I would recommend dTMS treatment to anybody who's suffering depression, because I think it gives your life back.
Joe's response to the Deep Transcranial Magnetic Stimulation was amazing. This is a person who I had been seeing for years, trying many different medications. So to have him report that he felt an improvement in his mood in response to this treatment was amazing.
So a question I know many of you will have is, so you got it, how do I get to it? The way you access that is really from a Cody Regional Health psychiatric provider. That's going to be primarily Dr. Pollard, because he has to supervise that, and there's some other things that go along with that, so he has to make sure all those things are done. So this can't be just a direct referral where you come into the clinic to get the TMS treatment. And new patients can call 578-2283. That's our Behavioral Health Clinic, and we're not ready to start scheduling appointments for TMS, so don't call yet. We're going to have a Live After 5 event in April, April 16th, and so we'll kind of provide updates then, also for those of you who want to attend that. As I mentioned earlier, most insurances will pay for TMS. A lot of people want to know, will Medicaid pay for it? Yes, Medicaid will pay for it. Will Medicare pay for it? Yes, Medicare will pay for it. Every insurance company is a little bit different about the number of trials of medications that you have to go through before you would be eligible for that TMS. So that's something, a question that I really can't answer for you specifically. And then I'm going to hand this over to Dr. Pollard, and he's going to talk in a little bit more depth about the science behind TMS.
So they said it's kind of new, you know. 1995 was the first time that they treated a person with a major depression with TMS and had a pretty dramatic result. And then until in 2005, I had the opportunity to go to, I'm sorry. 1995 was when they first did the first treatment of a patient with depression with TMS. And in 2005, I got to go to Columbia in New York City and spend a 3-day course there where I did training in using it for research purposes. I was involved in a research program back in Morgantown, West Virginia, where we were using TMS as not to treat depression, but as a way of understanding how the brain was working. And it was really exciting, you know, but I had to wait until 2010 when they first came. The FDA first approved a particular machine. And what they do, they have to approve each machine. It's not just the idea that it gets approved as individual machines. And so this machine, the Brainsway TMS, I think is the one that provides us with the best future utilization. It's the only TMS machine that actually can treat another disease called obsessive compulsive disorder. We're not going to be able to do that right yet, but look forward to doing that in the future, along with treating major depression. So this is just a kind of a. We've been talking for so long about about the medicines that treat depression. Everybody's talking about serotonin reuptake inhibitors and trying to balance brain chemicals and stuff. And you know, it's been a pretty good run for the last 40 years, you know, with these sorts of antidepressants. But we still see a large number of people that don't get any benefit from any of them. So what happened with the ideas concerning why TMS works, we had to kind of rethink about the brain and realize that it's not just a bunch of chemical receptors. You know, it's not just driven by this chemical or that chemical, but actually functionally it is related to pathways, to kind of connections between different parts of the brain. And then more and more research, it seems pretty clear that the real problem with depression is that we lose the connectivity between the front part of the brain and the middle part of the brain. The middle part being the limbic area, and that's where emotions live. So when we have problems with that connectivity, then that's what we see with long-term depression. This is the area, these little red spots there, is the area that we're trying to stimulate when we use this TMS magnet. It's called the dorsolateral prefrontal cortex. Okay, so you don't have to remember that. But, so that's what we're trying to do. And in order to do that, we take, this is a kind of a picture of a description of how this up here is the magnet, and we're trying to stimulate this area here. This is a simpler explanation. Okay, so it's on the left side of the brain, in the front part of the left side of the brain, and the magnet then is it's kind of like it creates something called an action potential, and that's where there's actually a surge of electrical activity in the brain cells, and then it goes someplace else. And there's really not stoplights or dominoes, but it kind of coordinates an activity that kind of continues for a while. I think these are backwards, but and the result being that the happy person over there, that's the limbic system. That's where the emotions live. You know, he's happy after getting his dose of magnets. But the other thing, the way to think about this is that it's almost like that this circuit between our thoughts and our emotions, it's almost like a thought. And that when we have positive thoughts, it's kind of like what we're doing with the TMS session, but it's not just one positive thought, because we're doing 3,000 to 5,000 of these thoughts during a 20-minute session. Okay, and so during a course of therapy, that winds up being 100 to 150,000 of these pulses, or these events in our brain, and that results in change in our brain. It actually structurally changes over that time. It's kind of like practicing stuff, you know, and mastering stuff as a result of the practice. And even people who don't respond after a typical course of treatment, say 30, 32 treatments, there's another group of people, like 20% more will respond if they keep doing it for another few weeks. And it's, the other thing is, it's the way that the time of treatment and the number of treatment, it's not like etched in stone. It's still something that we're still working with. Some people can have found that if you're trying to get 30 treatments in totally, that you can actually do 5 a day. An individual person can have 5 a day for 3 days a week. So wind up getting it over a 2-week period, a full course of treatment. And those people do at least as well, and sometimes better, than the people that are having to do it over 2 or 3 times a week. So And then sometimes the 20-minute session, different sorts of protocols or different sorts of patterns of treatment can last as short as 5 minutes. So it's got a lot of, variation there that we'll be working on and trying to stay on top of. And so this is just kind of an example. When we're talking about the connections in the brain, it's almost like these patterns of highways, and these highways have been blocked for whatever reason, or maybe they get potholes. They need chip sealing, and so that the TMS actually kind of helps make these connections in our brain, make them smoother and more passable. This is really interesting. This is a large group of people that had TMS treatment and responded to it. And what they did with this is an MRI, and these MRIs can actually measure the size of different areas of our brain. This area here, it's kind of in that dorsal frontal lateral creep. That's the area we're targeting. So what happened over this time is that it actually grew bigger. The brain actually grows, which if you asked me this 10 years ago, I'd say, the brain doesn't grow. It's like all downhill, from when you're young. But indeed, it changes. And that's part of the permanent solution that comes from the transcranial magnetic stimulation that you don't get with the medicines. And then so there's all these areas that actually wind up having growth. And that growth relates to the response to the antidepressant effect. And this again is about nothing sacred about the way we're doing the treatment sessions. And this is where you can call. And we wanted to be able to give you time to ask questions.
Hold on. Just let me say, this is the second time in 6 years I've had a speaker end on time or early enough to do plenty of questions, so thank you. So I know we have a lot of questions probably, but I need to make sure that you ask on microphone because we have an online audience too that needs to hear our questions. And then I'm going to have you two restate them. So, I know I have questions, but I'll start with whoever wants to go first. Okay.
When we saw that brain was the front of our heads.
Yep.
Left.
Yep.
So this area, this rib is way back out here.
Right, so that wasn't a part that was directly stimulated by the magnet, but the connectivity between the front part and the back part causes the back part to grow too. So it's not just what we're doing here, it's other events that are happening and growth is occurring. Go ahead.
Are there conditions in the brain, for instance, I had migraine headaches for at least 20 years, and they were only controlled when Imitrex was developed, that would prohibit the use of this treatment?
The main thing we have to be careful with are people that have epilepsy. There have been about 100 cases of seizures that occurred in the physician's office throughout the use of TMS all over the world. And they've been using it all over the world a lot longer than we have. So it's way less than, it's something like 0.5%, less than, actually I think it's less than 0.1%. Like one case out of every 1,000 treatments, so it's very rare. Interestingly enough, there's a lot of studies where they find that migraine headaches are one of the most responsive medical problems to.
Mine are already cured.
Awesome. That's all good.
Hi, Dr. Pollard.
Hey.
In our germophobic society and environment that we're in right now, when you look at the machine and you see that blue cap that goes on your head, and then you put that on and then somebody comes in after you, is there some kind of a barrier that the next person would put on so they wouldn't get headlights or what have you?
Good question.
So we have many caps, and we're also going to have a cleaning protocol for the caps. So the person coming in after you is not going to be wearing the cap that you wore. So there shouldn't be any risk of head lice, or if somebody else comes in with a cold or flu or coronavirus, that you would get that from using that.
That's good.
And you probably noticed on the picture that there was like a tape measure, and so that's so that when we go to adjust the cap, we can put it in the very same place. So typically people will use the same cap through repeated treatments, so that we'll get it in the same spot. And it's like the way we find the spot that's supposed to, the sweet spot, is that first of all we have to stimulate there's something called the motor cortex over on the left side of the brain, connects to our right hand. And so you have to do a little stimulus here that causes a person's thumb to jerk. And that's how we know where we are. And then basically you kind of measure forward about 5 centimeters, and that's generally where you start. So it's a little bit more complicated than that, but it's pretty close. When we were talking about the pain, the discomfort is generally like anybody who's ever had any electric stimulation for muscles or chronic pain or something, that the electric stimulation causes muscles to twitch, right? So with the TMS, because it's generating an electric current, it causes the muscles to twitch too. And so most of the time, that muscle twitching over several thousand times during the 20 minutes can get kind of fatigued and causes a muscle ache. It's actually something that when you have further treatments, your body kind of adapts to it and starts releasing endorphins that basically make that pain go away. Also, people oftentimes will take a non-steroidal anti-inflammatory like Motrin or naproxen prior to their treatment.
So if you have a patient who is under medication, does this work in conjunction with the medication, or do they have to be off of their medications and then, so you can gauge how it's working?
Yeah, it's just be way too complicated to take someone off their medication, and we never know whether it's been partially effective or whether it's just not done a flippant thing, But if you wind up taking people off, then you have to wait for another 2 weeks or 3 weeks to see where you are. So there's no problem with the medicines you're taking, using this along with it. A lot of people will continue on it. A lot of people find they no longer need any medication.
My question is, what is the age criteria for this treatment? I see we only do adults at this time, and there are several, millions adolescents who also suffer. So I was wondering what that age group is.
Well, it certainly will work, for adolescents. There's no FDA approval for that though, so it's very unlikely that adolescents will be able to receive it at this point.
Yeah, Dr. Pollard, I was just wondering, does the research data support any conclusions about if it benefits younger brains, more middle-aged brains, or older brains are more affected? Just thinking that, the plasticity of the brain maybe is different at different ages, and And I don't know if there's any results showing that there's a benefit from different age groups.
Well, the more neuroplasticity a person has, the better response they're gonna have, because the neuroplasticity is what maybe chip seals, you know, the networks. But nobody totally loses that neuroplasticity, and we can increase neuroplasticity, you know, through exercise and through our diet. And they found that you get similar events, similar responses that occur as a result of meditation and mindful activities like yoga and Tai Chi and prayer. In fact, one of the things they found is that when a person is going through the TMS treatment, if they are focused on something positive, or if they're praying, you know, or if they're expecting something good to happen out of this, that it tends to help a lot. The work they've done with obsessive compulsive disorder and some anxiety disorders is if a person can bring some of these fears to mind while they're getting the TMS, it's more likely to be beneficial. So that's a really interesting part. It just kind of adds to the other things that we're doing.
Does this TMS procedure been shown to be helpful for sufferers of PTSD?
Actually, it has, yeah. And one of the strengths of it is that in PTSD, we develop these drills, like the stop signs in that picture in our brain. So that's some of the barriers that occur as a result of things that we've learned in our life to don't do that anymore. And so trauma is one of those things that help us develop those barriers. So it's been shown to be very helpful with PTSD.
Yes, Dr. Pollard, my question is about long-term effects. Is this something that you can expect to last the rest of your life? Is it gonna have to be repeated at some point in time? And also I have a second question about, you mentioned epilepsy, but what if you just have a seizure disorder in your history? Are you likely to have seizures after a treatment?
It just means if you had a history of having some seizures, but it's not kind of a recurring thing, then it's something we would just be careful with, and we might have you can dial up the intensity of the magnetic stimulation. It's kind of based upon what it takes to make your thumb twitch. And we start there, and then we can increase it as we go. But maybe in a situation where a person's had seizure activities before, that maybe wouldn't go as fast. But it's not an absolute problem. In terms of the long-term effect, there's kind of a basic rule that we've seen that if it helps a person at one point, it'll help them in the future. And sometimes people will continue to, if they've had a relapse, then maybe you go and you have like a treatment a month that will keep you responding. And because of the changes in the brain, you know, because this is something that's a permanent change. And that's something that everybody's heard of ECT, electroconvulsive therapy. And that was the first kind of electrical treatment we did for brains and depression. Well, the problem is it doesn't cause any permanent change unless the person just loses a memory, which can be kind of permanent. But it doesn't cause a permanent change in terms of regrowing stuff, you know, or a positive change in the brain.
These are wonderful questions. We've got 5 more minutes if we want to have a few more.
Can people with pacemakers use this because of the magnetic field?
Yes, ma'am, you can. There's some protections we need to have, you know, surrounding it, but it's still something you can do. Sometimes people who have had, you know, metallic implants or something, like clips for aneurysms in their brain, sometimes that can be a problem, but it's something that we'd be able to work around. The effect of the magnet only extends down about less than an inch, you know, so it's not something that's gonna be affecting the deep part of the brain.
I was wondering, sorry, my voice is really bad. I was wondering if this has been used for physical injuries like brain damage or only psychological disorders.
Actually, there's been a whole lot, most of the work that's been done with TMS has been done surrounding how it affects the connectivity in the brain. So how it affects the connectivity in the brain of someone who's had a brain injury, who's had a stroke. There's studies about how it seems to help people who have multiple sclerosis. There's all sorts of things they're looking at. Right now, the only indications we have are to use it to treat major depression, treatment-resistant depression, which means that the person has failed at least 2 antidepressants, or to treat obsessive compulsive disorder. So those are the 2 indications right now. They're using it for a lot of other things in a lot of other places around the world, but we're kind of careful about how quick we go with things.
Hey, Doc, I have a question. So, so often we put people on meds and we say, no, you're gonna feel worse before you get better. I'm really sorry. The next week is gonna be a bit brutal. Your anxiety's gonna get worse. Maybe you'll have more trouble sleeping. What are the odds that most people start this treatment, that they will get worse before they get better?
It doesn't seem to be something that happens very often. It seems that people begin to have a positive experience pretty quickly. And you don't have to wait for, let's give it 6 weeks, that's not how it works. It's much more rapid than that.
Yes, Dr. Pollard, thanks for coming today. I have a question for you in regards to the OCD aspect. What kind of improvements do you see as far as the OCD? I didn't realize that was connected in the emotional part of the brain.
Yeah, well, you see a diminution in the compulsive behavior. OCD is a type of an anxiety disorder, and so the treatment for OCD is actually on the other side, on the right side of the brain, but in the same general area. And again, it also has the same sort of changing in connectivity that treatment for depression causes. The studies with it are pretty robust. I mean, it's pretty strong evidence that it's very helpful. Up to this point, as far as I know, there aren't any insurance companies that are willing to pay for it. So again, there's an indication for it, and there's a special helmet actually, or there's a special coil to treat OCD because it's in a different area. And we don't have the coil right now, but depending on how we do with the depression treatment, we're looking forward to being able to have one of those too.
Steve probably doesn't want me to bring this up, but talking about payment, so say I've got a couple people in mind right now, I'm listening to you talk going, this sounds amazing. And do they have to have had a history of trying to use, again, medication for depression before they can qualify for insurance coverage for this? Or can they come to you and then you work with them and then pay out of pocket for things like OCD that's outside of that depression realm? And how much does it cost out of pocket on average?
I love the times I get the microphone. So OCD is just not a treatment we offer, period, at this point, because it's a separate helmet. And so we're really just kind of waiting for insurance companies to be willing to pay for that. That's about a $60,000 to $70,000 helmet to use with that TMS machine. I actually mentioned before, TMS is a very expensive machine. I can buy a house and our TMS machine is not even as big as this. So it is pretty pricey for the machine and for the helmets that go with it. In terms of the cost of the TMS treatments, if you were to pay out of pocket, we haven't set that for Cody Regional Health yet. I can tell you nationally that price ranges from about $300 to $500 per treatment. Our price will probably fall in the mid-range of that, but I can't say that for absolute certain now. And I will tell you the reimbursement rates for insurance companies varies wildly too. Most insurance, or at least insurance companies like Medicaid and Medicare pay considerably less, but it's still enough to allow us to offer the treatment and to be able to keep it in the community once we have the machine, which is a great thing. And I just want to applaud the foundation again. The great thing about the fundraising from the foundation and the Co-Medical Foundation is being able to put that money into it, lets us bring something into the community that we probably wouldn't be able to bring in otherwise. As far as being able to directly access TMS, if you haven't had any other treatment for depression, your insurance wouldn't pay for it. I would have to hand it back to Dr. Pollard for him to say whether he would be willing to, if somebody's paying out of pocket, go ahead and have them move to TMS as a first-line treatment.
That's a question a lot of people have been dealing with. And over in Europe, they basically have kind of two health systems over there. They have the state-run system and the private system. And the private system, people frequently will use TMS as a first-line treatment for depression, especially people who have concerns about side effects of medications. So there's no reason to think it doesn't work at least as well, and probably even better, than people who've had lots of failures. But again, my biggest interest right now is just on the people that have had lots of people who've had many failures with their medications, and the cost of medications, can be exorbitant too. So to be able to have something that can maybe treat it for good, and have done with it, and have a long, durable effect is pretty amazing.
Yeah, well, thank you. I think that helps just to know that $300 to $500 range, even out of pocket, for someone like me that's curious. And then also, I just wanted to point out, I think are we the only one in the state, or one of two out of state offering this service now?
The service is also offered in Cheyenne. It's a joint project with the Community Mental Health Center and a private company down there that is actually run under the private company. And I did want to emphasize on cost, $300 to $500 per treatment session, not for the entire treatment, just to make that clear to everybody.
Not cheap, but life-changing. Okay. Can we give them a round of applause?